Kaiser Family Foundation Study found health insurers under the Affordable Care Act have denied around 1 out of every 5 insurance claims.
Yeah, so what this does is it leaves families needing critical care desperate for other options. But as Joe Ripley reports tonight, AI is giving patients a boost in their fight for health care.
Neil Shaw turned his wife's fight into fuel.
I went through a multi-year cancer journey taking care of my wife. And, the hardest part of the whole thing was actually fighting the insurance companies.
He would often run into barriers, coverage claim denials, after spending time and money he didn't have.
We think the field has been tilted towards insurers. And, denial rates have gone through the roof over the last few years.
In the fight for adequate health care insurance coverage, patients are getting a boost from artificial intelligence. So Shaw created Counterforce Health, which uses an AI platform to write custom appeals when patients' claims are denied.
Not only can the AI do in 2 minutes what it might take you 8 or 10 hours to do, it can actually do a better job.
Shaw says AI can scour sources to determine how effective medicine can be, lay out a patient's medical history, and do so all in a fraction of the time it would normally take.
Families are in a very stuck situation. They don't know what to do.
Letitia August, an Emory University student and aspiring nurse, says many of her patients win their appeals within a matter of days. August says while there's still some skepticism around the evolution of AI, she says there's always room for improvement, especially in matters of life and death.
I understand where they're coming from. With the way, for the past few years, on how AI has been growing, there has been a lot of mistrust in it, but there have always been room to improve it.
In Atlanta, Joe Ripley, 11 Alive News.
Our thanks to Joe for that report. And Shaw says that many coverage denials come down to processing errors by insurance companies. He says Counterforce Health relies on grant funding, and there's no charge for this service.